Assessments are what we do in psychology to get a better understanding of individuals and what it is that they're experiencing or going through or feeling at that time. If you or a family member have been referred for psychological testing, you probably have some questions about what to expect, or you may have heard about psychological testing and wonder if you or a family member should be tested. Sometimes psychological testing may sound intimidating, but it's designed to help you. In many ways, psychological testing and assessment are similar to medical tests. If a patient has physical symptoms, a primary care provider orders x-rays or blood tests, right? The results of that test help you develop a treatment plan. Psychological evaluations or assessments serve the same purpose. Psychologists use the tests and other assessment tools to measure and observe a client's behavior to arrive at a diagnostic or a diagnosis and help guide the treatment process. Clinicians use the assessment process to provide a diagnosis, or at least a tentative diagnosis, of an individual's psychological disorder. It's used to evaluate an individual's appropriateness sometimes for a particular job. It's useful when clinicians consult about an individual's level of functioning in a specific area. You've probably taken some type of an assessment before when you've applied for certain jobs. You know, businesses often use these to help screen individuals to see if they'd be a good fit for their business or their company. In order for a test to be considered good, it needs to be reliable and valid. If it has the reliability, that means that it's consistency of the scores that it produces. So we can give it to multiple groups and we're going to see consistent scores among all the groups. The validity is the extent to which a test measures what it is designed to measure. That's content validity. Standardization is the psychometric criterion that clearly specifies a test's instruction for administration and scoring. When we interpret test results, clinicians need to ensure that they don't fall into the Barnum effect. We use evidence-based assessment, which is relying on research findings and scientifically viable theories. We also use psychometrically strong measures. We refer to a lot of research that was conducted to make sure that we have the validity and the reliability across whatever psychological assessment we're using. We look for empirical findings when we're evaluating the assessment process. The Barnum effect is the tendency to accept certain information as true. It's also known in psychology as this phenomenon that occurs when individuals believe that personality descriptions apply specifically to them, more so than other people. We see this a lot when we read horoscopes. The information is so vague, but we take it personally, meaning that it applies to us, and don't take into account that that horoscope applies to many people because it's written so vaguely. When we conduct a clinical interview, we do this in an unstructured or structured manner. If we're conducting an unstructured interview, we will ask the client a series of open-ended questions. This is unstructured so that the client can answer as they so choose. We might ask questions about the client's health status, their family background, life history, ask them why they are seeking help at this time. We might take note of their apparent mood, their tone as they're answering questions. We're just observing their overall psychological state. If we're doing a structured interview, this is more of a standardized series of questions that we're asking, and we will use this to make a diagnosis on axis 1 as well as axis 2 of the 5-axis scale. A structured interview is less subject to variations from clinician to clinician than what we see in an unstructured interview. We use this series of assessment questions that follows a predetermined wording and order to help provide a diagnosis and then to further base treatment or classify the client's symptoms into a DSM-5 disorder. These are different areas that we will cover in a clinical interview. Things like age and sex, gender, race, covers the basic demographic information. When we look for the reason for referral, we want to hear from the client in their own words as to why they're seeking treatment at the time. Their education and work history will give us information on socioeconomic status, whether or not they're working, what their occupational is, if they have any kind of educational background, their current social situation. We will be able to obtain information such as whether or not they're in a relationship and whether or not they have social support that could potentially be available. Their physical and mental health history can help us determine whether they have medical illnesses, if there's been any recent change in health. We can find out any present problems, including past diagnosis and treatments, whether or not that treatment has been helpful in the past. Drug and alcohol and current medication, if they're currently prescribed anything or if they've taken anything in the past. Family history will tell us if there's a past problem with other family members that they're aware of, any past psychological disorders that's in their family history that might be relevant to their current symptoms. And then the behavioral observations, this can include nonverbal behaviors as well. We can look for things like anxiety, altered moods. Does the client have difficulty paying attention? Are they compliant? We can check for things like whether or not the client is oriented to time, place, person. We can look for unusual motor behaviors. Generally, a clinical interview lasts about 30 to 45 minutes, depending on how much information the client is providing and how detailed they're being, as well as how cooperative they are. This list is things we look for in a mental status examination, which is a method of objectively assessing a client's behavior and functioning to the symptoms associated with psychological disturbance. The outcome of the mental status examination is a comprehensive description of how the client looks, thinks, feels, and behaves. There's also an MMSE, which is a mini mental state examination, and that's a structured tool that clinicians use as a brief screening device to assess dementia. There's different types of intelligence tests that we can give. Stanford-Binet is one of our intelligence tests. The average deviation, or IQ score, is set at 100 with a standard deviation of 15. So if 100 is our average IQ, we have 130, which would be considered gifted, and 70 would be the cutoff for an intellectual disability. We look for a deviation intelligence, which is an index of intelligence derived from comparing an individual's score of an intelligence test with the mean score for that individual's reference group. The test administrator records the scores from each test and then converts them to standardized scores. So there's 5 groups that we test for. The Stanford-Binet is in its 5th edition right now. We look at the fluid reasoning, knowledge, quantitative reasoning, visual spatial reasoning, as well as working memory. And then we also have the Wechsler Intelligence Scale. This was originally developed in 1939 by Bellevue Hospital, David Wechsler. This is in the 4th edition, the revision. There also has a parallel test for children So we have one for adults and we have one for children. The children's one is the Wechsler Preschool and Primary Scale of Intelligence, is also in its 4th edition. And so this is measured in 4 parts: verbal comprehension, perceptual reasoning, working memory, as well as processing speed. We look again for test and retest reliability. This is going to compare the original test scores with the retest scores. We look for the alternative form reliability and then the split half reliability. Oftentimes clinicians or school psychologists will use intelligence testing. They look for learning disabilities, they look for the giftedness, they look for the intellectual disability, or sometimes to predict future achievement or academic achievement. The school psychologist will do this if an IEP is needed, which is an individualized education plan. So a child will go through a series of tests to determine what services are needed, and then the individualized education plan will be written to ensure that child is receiving the services that they need based on their performance on the intelligence tests that are taken. The most current version of the Wechsler Adult Intelligence Scale was released in 2008. So this is administered to people between the ages of 16 and 90. It's composed of 10 core subtests and 5 supplemental subtests. So the full scale IQ is considered the most valid measure of the overall cognitive ability. The verbal comprehensive index is designed to measure verbal reasoning and concept formation. The perceptual reasoning index, PRI, is designed to measure fluid reasoning in the perceptual domain with tasks that assess nonverbal concept formation, visual perception and organization, visual motor coordination, learning, and the ability to separate figure and ground in visual stimuli. The working memory index is the ability to sustain attention, concentrate, and exert mental control. And then the processing speed index is the ability to process simple or routine visual material without making errors. These 5 indexes were constructed to have means of 100 and standard deviations of 15 IQ points. So an IQ of 100 defines the performance of the average adult at that age. About 2/3 of all adults obtain IQs between 85 and 115, which is 1 standard deviation below and above the mean. About 95% score between 70 and 130, which is 2 standard deviations on either side of the mean. And more than 99% obtain scores between 55 and 145, which is 3 standard deviations from the mean. This shows you the structure, the breakdown of the Wechsler Adult Intelligence Scale. The test is given one-on-one with the clinician, and so there are behavioral observations that can be made as well. So things like language fluency, physical appearance, problems with vision, hearing, motor behavior, all of these things can be noted, and any unusual behaviors that the test taker shows can be observed as well. So this one talks about the Myers-Briggs type indicator, which some of you may be familiar with. A lot of college students have taken this assessment before. This is a self-report and projective test. It differs in the nature of their items and the way they're scored. Through a series of questions, the MBTI assessment helps you identify your natural preferences in 4 areas of personality. How do you direct and receive energy? By focusing on the outside world, interacting with people, and taking action, or by focusing on your inner world and reflecting on ideas, memories, and experiences. Then we look at how do you take information? How do you take in information? By focusing on what you perceive using your 5 senses, or by seeing the big picture and looking for relationships and patterns. How do you decide and come to conclusions? by logically analyzing the situation or by considering what's important to the people involved. Lastly, how do you approach the outside world? In a planned, orderly way or a more flexible, spontaneous way? Your natural preferences in these 4 areas sort you into one of the 16 distinct MBTI personality types. Understanding these types give you objective insight that you can use to enhance your professional and personal relationships, as well as your direction, focus, and choices. For self-report tests, there's some advantages. They're relatively easy to administer and score. They are the most popular self-inventory, which is the Minnesota Multiphasic Personality Inventory, which is the MMPI, or the revised MMPI-2. There's a Personality Assessment Inventory, PAI, which has its advantages as well. Clinicians can use it with clients who may not have the language or the reading skills to complete the MMPI-2. One calculates the validity scale independently of any of the content scales. There is the SCL-90-R, which measures the test taker's current experiencing of 90 physical and psychological symptoms. The advantage here is that it focuses on the client's current status rather than asking about symptoms over a previous period of time. And the NEO Personality Inventory, which is also revised, measures personality along 5 personality dimensions or sets of traits. You can see images here from the Rorschach, which is considered a projective test, which is a technique in which the test taker is presented with an ambiguous item or task, an image here in this case. They're asked to respond by providing his or her own meaning or perception. So this is the most famous or well-known, the Rorschach inkblot test. It was founded by Mark Matthews and aims to continue providing an online resource for information about ethical and professional use of the inkblot test. The vision is to provide fair, unbiased, accurate, and useful professional, scientific, and objective information to students, professionals, and laypersons regarding this inkblot test. The skilled professionals that utilize this do so in an appropriate manner in appropriate settings and do it to answer appropriate clinical questions. The Matthews that I mentioned established the website that is used for the Rorschach test in 1996. He's the one that founded this website where we utilize this test today. A lot of clinicians do. Much of the controversy regarding this test surrounds the definition of the word appropriate. The thematic apperception test is another projective test that uses pictures to describe or measure emotional and psychological states. So when you look at the picture, you ask yourself questions. What happened in the picture? Do they know each other? Where are they? Did he harm her? Are they lovers? The task is to tell a story about what's happening in each scene. You want to focus on details, what the characters in the picture are thinking, what they're feeling. The purpose was to evaluate motivation, such as the need for achievement or the need for power. The TAT for short involves showing people a series of picture cards, such as this one, depicting a variety of ambiguous characters that may include men, women, and or children, scenes, and situations. The clients are then asked to tell a dramatic story as they can for each picture presented, including what has led up to the event shown, what's happening in the scene, the thoughts and feelings of characters, the outcome of the story. The complete version of the TAT includes 31 cards. Murray originally recommended using approximately 20 cards and selecting those that depicted characters similar to the subject. Many practitioners today only utilize 5 and 12 cards, often selected because the examiner feels that the scene matches the client's needs and situations. For behavioral assessments, we record actions rather than responses to rating scales or questions. We include descriptions of the events that precede or follow the behaviors. For a target behavior, this is a behavior of interest or concern in an assessment. The in vivo observation is a process involving the recording of a behavior in its natural context. The analog observation is an assessment that takes place in a setting or context, such as a clinician's office or a laboratory specifically designed for observing the target behavior. A behavioral self-report, the individual provides information about the frequency of particular behaviors. Self-monitoring is when a client keeps a record of the frequency of specified behaviors. And behavioral interviewing is the assessment process in which clinicians ask questions about the target behavior's frequency, antecedents, and consequences. Neuropsychological assessment tests are derived from as the same type of test that's on the WAIS-4, the Wechsler one. Trail-making tests evaluate frontal lobe functioning, which focuses on attention, scanning of visual stimuli, and number sequencing. Executive function is the ability to formulate goals, make plans, carry out those plans, and then complete the plans in an effective way. The clock drawing test is where we give the client a sheet of paper with a large pre-drawn circle on it and ask the client to draw the numbers around the circle to look like the face of an analog clock. The Wisconsin card sorting test. We have the client that match a card to one set of cards that share various features. The Boston naming test, which is the BNT one here, is assess the language capacity. The PAST auditory serial addition test, which is the PASAT, is we assess a client's auditory information processing speed, flexibility, and calculation ability. It looks like I left that one off of here. The WMS-4 is the test of working short-term memory and long-term memory for visual and verbal stimuli. And then we have the Cambridge Neuropsychological Testing Automated Battery, which is the CANTAB here, which consists of 22 subtests that assess visual memory, working memory, executive function, and planning, attention, verbal memory, and decision-making and response control. Neurological tests, we often do diagnostic tests and procedures. These are vital tools that help physicians confirm or rule out a neurological disorder or other medical condition. A century ago, the only way to make a definite diagnosis for many neurological disorders was to perform an autopsy after someone had died. But today we have new instruments and techniques that allow scientists to assess the living brain and monitor nervous system activity as it occurs. Doctors now have powerful and accurate tools to better diagnose disease and test how well a particular therapy may be working. Perhaps the most significant changes during the past 10 years have occurred in genetic testing and diagnostic imaging. Much has been learned from sequencing the human genome, which is the complete set of a person's genes, and developing new technologies that detect genetic mutations. Improved imaging techniques provide high-resolution images that allow physicians to view the structure of the brain. Specialized imaging methods can visualize changes in brain activity or the amounts of particular brain chemicals. Scientists continue to improve these methods to provide more detailed diagnostic information. Researchers and physicians use a variety of diagnostic imaging techniques and chemical and metabolic tests to detect, manage, and treat neurological disease. Many of these tests can be performed in a physician's office or in an outpatient testing facility with little risk, if any, to the person. Some procedures are performed in specialized settings to determine particular disorders of, or abnormalities. Depending on the type of test, results may be immediate or some take time to process. A neurological examination assesses motor and sensory skills, hearing and speech, vision coordination, and balance. It may also test mental status, mood, and behavior. The examination uses tools such as a turning fork, flashlight, reflex hammer, and a tool for examining the eye. The results of the neurological examination and the patient's history are used to determine a list of possibilities known as a differential diagnosis that help determine which additional diagnostic tests and procedures are needed. And on our last slide here, these are some neuroimaging techniques that we do. Neuroimaging provides a picture of the brain structure or level of activity and is a useful tool for looking at the brain. Our EEG measures changes in the electrical activity of the brain. The CT or CAT scan is a series of x-rays from various angles around the body that are integrated by a computer to produce a composite picture. The MRI is a use of radio waves rather than x-rays to construct a picture of the living brain based on the water content of various tissues. The PET scan is a measure of brain activity in which a small amount of radioactive sugar is injected into an individual's bloodstream, following which a computer measures the varying levels of radiation in different parts of the brain and yields a multicolored image. The SPECT, which is a single photon emission computed tomography. This is a variant of the PET scan that permits a longer and more detailed imaging analysis. The MRS is a proton magnetic resonance spectroscopy, which is a scanning method that measures metabolic activity of neurons and therefore may indicate areas of brain damage. And then our fMRI is a variant of the traditional MRI, which makes it possible to construct a picture of activity in the brain. And that is all for our chapter on assessments.